Hello, my friend. Thank you so much for popping by. So, today I am looking at public health and spiritual disconnect. This is an article that I'm actually reading from the Harvard Public Health publication. And this is an article that was published on September 10th, 2024, a few days back. I am reading this on September 13th. So, 3 days ago, this article was published. And we are talking about something that I feel very strongly about, which is the disconnect of spirituality from public health, right? Here's what they have to say. Religion is a social determinant of health, too. Yes, it is. Totally, it is. Let's hear what they say. This is an article that was written by Caitlin Long, David Rosmarin, and Howard Core. I could be saying those names wrong, and I apologize. But here we go. This is what they have to say. The separation of church and state has long represented a hallowed legal principle. As a result, perhaps the field of public health has often divorced itself from spirituality to the detriment not only of the diverse populations we serve, but also of ourselves. The vast majority of people in the world, including those who live in the United States, identify with a religious or spiritual tradition. But public health educators, funders, and practitioners have not yet fully recognized the large body of evidence that links spiritual practices and identity with a host of positive health outcomes. Few medical or public health students, for example, study the link between spirituality and health. Faculty seldom share their own spiritual values in the classroom. The rare academicians who identify as religious or spiritual tend to self-censor. These blind spots harm us all. Students entering the world of public health rarely get to examine, in an academic setting, the values that drive them to find ultimate meaning and purpose in their lives. During the COVID-19 pandemic, the lack of collaboration between public health leadership and religious communities eroded communication and trust and contributed to some religious communities experiencing disproportionate levels of non-vaccination and COVID-related illness. Our team from the Harvard Initiative on Health, Spirituality, and Religion studies ways to bridge the public health disconnect between body and soul. As part of our commitment to research and practice, we worked in 2022 alongside several dozen colleagues nationwide to analyze the most rigorous studies published on the topic this century and to make recommendations for the future. So, what do they recommend? We recommended, along with our co-authors and a national expert panel, that religion and spirituality, that is meaning, purpose, and connection to something bigger than ourselves, should be recognized as a social factor associated with health. We also recommend that public health professionals and students learn about the association between spirituality and better outcomes. We suggested that healthcare professionals consider the benefits of spiritual community participation to improve health. Primary care doctors can ask that patients connect to the faith or tradition that helps them, if one exists, especially in times of need. They can also suggest other forms of community for patients who don't identify as religious or spiritual. These efforts are not yet fully part of mainstream public health initiatives, but public health leaders can begin to move forward. Spirituality, including religion, should be recognized in public health and medical education, including through lectures that review the surprisingly large and strong body of evidence on this topic. Communication, relationships, and trust between public health leaders and faith communities should be fostered. These efforts must anticipate and welcome different worldviews, focusing on common goals while acknowledging that at times religious differences are sources of disagreement and even harm. Finally, there must be better national coordination between academic and faith based groups to understand and measure public health efforts. Future research should also consider outcomes that matter to spiritual communities, such as increased hope, a sense of meaning in life, or improved social connection. Bridging the gulf between spirituality and public health could make us all healthier. Doing so will not always be easy or comfortable. Oh, doing so will not always be easy or comfortable. In many cases, it will mean engaging with new communities and new ideas. But public health requires appraising the wide range of factors linked to health and well being and following the evidence with humility and courage. Only this will bring us closer to the fundamental human right of the highest attainable standard of health. Yeah, I am in total agreement with this approach. I am in total, absolute, wholehearted agreement with this approach and this initiative, right? What they're saying is it's not yet happening on large scale, but this is what this Harvard Public Health recommends in terms of practice, right? I absolutely agree with this. Public Health Spiritual Disconnect is the article, and it's an opinion piece that is written on the Harvard Public Health, and I will share a link to this article down below. Alrighty, my friend, I hope you're having a lovely day where you are, but most importantly, I hope you're having a healthier day wherever you're watching from. Alrighty, bye.